An NHS community gynecologist has issued a warning to women to keep an eye out for warning signs and head straight to your GP if you have them. It comes as March marks Ovarian Cancer Awareness Month, which seeks to increase knowledge about the disease. Around 7,400 women are diagnosed with ovarian cancer in the UK each year, according to Cancer Research UK, so it's important to know what is normal and what is not. As early warning signs can be subtle and associated with other common conditions, The Mirror spoke with Dr. Susanna Unsworth to highlight symptoms you should never ignore. She said that whilst many of the symptoms are subtle and do not mean you have ovarian cancer, it is always better to be safe rather than sorry, and therefore recommends getting checked out to exclude any underlying problem. The doctor warns of key symptoms to look out for, which include bloating, pain, urinary symptoms, a lump, swelling. Dr. Unsworth explained that if you are experiencing bloating that does not settle within 2 weeks, bloating that is happening frequently without an obvious trigger, or bloating that is not resolving with the usual treatments/dietary changes, it's worth calling your GP. As well as bloating, you need to be wary of pain in the pelvis, back or lower abdomen that does not quickly settle, according to the expert. And if you notice you are passing urine more frequently or suddenly need to get up during the night to pass urine, this could be a warning sign. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up, and no one can send messages except the Daily Record team. All you have to do is click here. If you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. Dr. Unsworth recommends seeing your GP straight away if you experience a loss of appetite, feel full quickly after eating, or if you notice any lump or swelling in the lower abdomen or pelvis. Although she claims this would be an unusual early sign, other symptoms to look out for include persistent indigestion, change in bowel habit, either constipation or diarrhea, unexplained weight loss, persistent fatigue, or abnormal vaginal bleeding. She goes on to explain what you should expect if you speak to a GP about any of these issues, saying, "These symptoms can often be quite subtle, and many are associated with other common conditions such as irritable bowel syndrome. The key thing is if the symptoms are new to you, are different to your usual symptoms, or do not respond to your usual treatments, then it makes sense to get them checked out. When you see your GP, discuss the symptoms you are experiencing. I would also suggest telling your GP that you are concerned about ovarian cancer. As a doctor, it is much easier for me if I also know what you are worried about, that way I can assess the problem fully for you, making sure whatever is done has helped answer the questions you had." After discussing the symptoms, your GP will likely want to do an examination. This will include an examination of your tummy, and may also include an internal vaginal examination, as this is the best way to see if there are any swellings around the ovaries. In early ovarian cancer, often the examination will actually be normal, as there may not yet be anything to feel. Therefore, your GP will likely arrange other tests for you, such as a pelvic ultrasound or Ca-125 blood test looking for a protein known as a tumor marker. Dr. Unsworth adds, your GP may also want to arrange other tests as the symptoms of ovarian cancer can be fairly vague and can overlap with other conditions. This might include other blood tests to look for inflammation or potential causes of tiredness, or may also include tests of your poo to look for any bowel problems. If any of these tests raise any level of concern, your GP will refer you to see a gynecology specialist to arrange further assessment. If the tests are normal, the likelihood of ovarian cancer is extremely low and other options to manage the symptoms can be recommended. Dr. Unsworth is an NHS community gynecology and menopause specialist and the founder of Cambridge Women's Health Menopause Clinic and Menopause Supplement Meno8. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.